Good morning, everyone, and thank you for joining us for this morning's session of Aging Strong and Falls Prevention. Now I'd like to introduce our speaker for today. Debbie, thank you so much for joining us and continuing this program.
Thank you so much, and good morning, Carrie. I want to thank the Quincy Public Library once again for allowing me to do my injury prevention outreach work for Tufts Medical Center. So today I have a special guest, actually two special guest speakers. Dave Barber is the owner of Body Mechanics, and he is a physical therapist. And along with him, another physical therapist that works with Dave is Amanda Kuzmak. And today they'll talk about easy exercises that can help reduce falls. So Dave, please take it away.
All right, Debbie, let's see. I'm just going to get our presentation up here.
Yeah.
All right, and I'm just going to open with thank you guys so much for the opportunity to be here. We're really passionate about falls prevention and anything that we can do to kind of help our community age and live well. One of the biggest questions that we get when we're talking about fall prevention is why? Why is this so needed? Why all of a sudden am I starting to feel a little unsteady, a little off balance? I've been living life, I've been living well, moving along at my own pace, and all of a sudden things seem to be changing for me. All right, so three big topics that we're going to discuss today are atrophy and degeneration, balance and its subcomponents, and then planes of movement, which is a consideration that we as physical therapists use all day, every day in all of our treatments to both assess and then to go on to treat and correct any deficits our patients might be experiencing. So we're going to talk about atrophy first. And as our bodies age, things begin to change, and people hear this big spooky word called atrophy. Sometimes it's associated with changes that happen after a surgery, but on a day-to-day basis, and less traumatic or less critical instances, it's just a gradual change and a gradual weakening of our body that happens with a little bit of what we like to call benign neglect. So just as a working definition, it's a progressive degeneration or shrinkage of muscle or nerve tissue. Sometimes people don't consider nerve atrophy. And for falls prevention, nerve atrophy is very significant because it's one thing to not necessarily be strong, but it's another thing to not be able to use the strength that we have. So this is a common demonstration or illustration of what people think of with muscle atrophy. And what I want to talk about on this slide is that not only is muscle atrophy the shrinkage of muscle, but it's the change of the quality of that muscle as well. Muscles not only, the cells not only physically become smaller, but there is speckling of fatty tissue within inside of a muscle. So if we think of a muscle like a rubber band or an elastic band, and all of a sudden parts of that elastic band were to start to dry up and no longer be elastic, that's a good consideration for kind of the fatty substrate that enters into the muscle tissue as we age. And that's a natural process that naturally happens, again, with that benign neglect, that this fatty substrate starts to enter the muscle. And with that, it's harder for the muscle to do its job in a healthy way. So what can we do about it? So obviously we're physical therapists. We're going to talk about exercise. Amanda is a huge advocate for exercise. She's not only a physical therapist, but she's a personal trainer. She's very active in the fitness world and in a number of community fitness programs that we're going to talk about a little later on. But there are a number of big resources, the American Heart Association, the American Physical Therapy Association, and countless articles of research that talk about evidence to prove that regular exercise can help retain lean muscle mass and can reverse the effects of atrophy. It's like anything else. If you practice and practice, you get better, and your body responds the same way. It conditions well. It does well under the right amount of stress and strain. But in the absence of that stress, our body stops growing and starts to become weaker. So again, just to mention those research studies, and a resource that I personally, my go-to resource for this, as well as anything else that I'm looking for that's new, current, science-based. I really like the NCBI resource, National Center of Biotechnical Information, but there are a number of other resources as well. Of course, our friends at the Thomas Crane Library, I'm sure it could be a huge resource to kind of figure out where you can get some evidence-based studies in case you do want to know more of the science behind, fall reduction or anything else for personal health and wellness. So, reviewing those research studies, it's important to stay up on the latest and greatest, but some of these things have been set in stone for a long, long time. Exercise has numerous benefits for the cardiovascular system, reduction of heart attack and stroke risk. There's improvement in general wellness, weight loss reduction, improved BMI or body mass index, which is, it's a tell for general health. And in addition to all of these kind of well-known instances, and of course, the improvement of physical strength in the body, there are a number of studies that talk about the neuroprotective effect of physical activity and exercise as well. So again, referencing some of those studies, there's a number or a large amount of evidence that says that regular physical activity can help prevent nerve degeneration with the big scary diagnoses, Parkinson's disease. It can help combat against Alzheimer's disease. And even without those big scary named diseases, it can also just kind of help protect against the natural degeneration of nerves that happen with, again, benign neglect or lack of use. So, the American Heart Association, the American Physical Therapy Association, there's a recommendation that all adults benefit from, either 150 minutes of exercise a week or 75 minutes of rigorous or vigorous exercise. And when you break it down, it's half an hour a day of regular gentle movement, or just 15 minutes a day of something a little higher intensity. As far as resources for if you've been out of the exercise field for a little while and you'd like to safely and gradually enter back in and you're not sure where to begin, there are a number of resources in your community. Of course, we're going to advocate for physical therapists and primary care physicians to have a conversation about your personal medical history and to make sure that you're medically safe to exercise. A physical therapist might be able to take a closer look at as far as an evaluation and say, okay, you're missing this element of strength or this neurological sense, might be impaired. And we might be able to prescribe some exercises to help combat some of those things. And we're going to do a general overview of that in just a bit. And then there are other community resources as well. The Council of Aging, local groups, local fitness groups, community fitness groups. There's a community fitness group that's just down the road from us. They're called 110 Fitness. And Amanda does a lot of work with 110 Fitness. Actually, why don't you go ahead and pop in and tell us more about that?
Yeah. So as Dave mentioned, I'm a physical therapist here, and I'm also a fitness coach down at 110 Fitness with owner Brett Miller and coach Anna Dunbar. 110 Fitness is the largest wellness center for people living with Parkinson's in the world. So they offer really great programs. They offer fitness classes that are research backed to help make sure that these participants are aging well and that they're able to continue participating in what they want to do every single day. But I think one of the things that keeps people going back is they have these community events that gets all of these people together. They get to know each other, they're friends, and it keeps them going back. So find your community that you want to exercise with, find your trusted professional, and then find a friend that will, as simple as go for a walk with you. And you can find these community programs all over.
So like Amanda was just saying, it's really critical to have some sense of community or accountability, something to, it's easy to get something started. It's hard to keep up with it. And practice is really key for fall prevention. So now going on to talk about balance and what balance is and its subcomponents, and some of the things that doctors or physical therapists will take a closer look at as far as assessing why is someone starting to have difficulty with balance? Why are they suddenly unsteady? So vision, our sight, right? Our sight is critical. Vision is probably the most impactful sense as far as our ability to detect whether we are upright and steady or if we are not upright and steady. And the logic of it is as simple as, we look in front of us and our brain knows to orient ourselves to a relatively upright or vertical position. If you are struggling with vision, it might be something as simple as needing, a prescription lens. But there are other smaller simple considerations for day-to-day interactions and day-to-day travel, obstacles, so on and so forth. Vision in your home, it's important to have good light, good illumination from, the places that you are regularly in and operating in throughout your home. So potentially night lights in the bedroom, the hallways on the way to the bathroom, easy access to the kitchen, and then quick access to light switches in those areas as well. Or if you're going out to like a wedding or something like that, or a late night function, try to travel in groups, try to make sure that you're traveling along well-lit pathways. Proprioception, this is one of our favorites in PT. So proprioception is this idea of a brain-body map, so that when we close our eyes, our body still knows where it is in space. So my favorite example of proprioception is if you're able to put your hand up at like a 90-degree angle, and you take your hand down and then you close your eyes, you should be able to replicate that 90-degree angle without your sense of vision and without any other kind of tactile cue to get you there. If you can't do that, you may have an impaired sense of proprioception. Now, why this matters in terms of fall risk reduction is if you don't know where your feet, ankles, knees, legs are without looking at them, you're going to have an awfully hard time getting around safely. So we're going to talk more about proprioception and how to assess and correct that sense in a little bit, but it absolutely is very critical. Somatosensation, it's part of our nervous system that, it kind of facilitates the idea of pressure under our feet. It is that sense of pressure under our feet. If we were to stand up and tilt back and feel more pressure on the heel, or lean forward and feel more pressure on the ball of our foot, if we were standing at the edge of a table or counter and to lean forward to reach for something on the back of the counter, you may feel increased weight under the ball of your foot. And that sense of pressure, that sense of weight, is another critical component of balance. It's one of those three key pieces that tells our body, where are we, and are we safe, and are we centered? Planes of movement is that third critical piece that we wanted to talk about today. And as physical therapists, this is one of our regular tools as far as how do we assess and how do we help correct people who are having difficulty with their balance and being steady on their feet. So the idea of planes of movement is that it gives us some common language and it gives us some common factors to look at. And this is where we're going to quickly rearrange our setting here so that way you can see our full bodies as we start to move and as we start to discuss this idea of a three-dimensional world and how we move and how we talk about it. Planes of movement. Our bodies operate in a 3D world. And if you remember way back when to grade school math, when you used to have to graph out like an X, a Y, and a Z plane, our bodies operate in those same dimensions. So when we're talking about the X plane or movements from side to side, and this is where I'm going to have the man help me out to demonstrate here, we're talking about movements in what's called the frontal plane. We're going to talk more about that in a second. Movements in the Y plane, or movements front to back, are movements in what's called the sagittal plane or the coronal plane. And then movements in the Z plane or the transverse plane, this idea of a horizontal or a rotational movement. Yep. That's a little less critical for a fundamental talk about balance, but it is important to consider all three of these directions when we're talking about movement. So when we're talking about fall risk reduction, it's important to talk about whether someone can't sense an impairment in one of those planes of movement, or if they can't correct a fault in that plane of movement. So in order to correct the risk, we have to both, assess, can they sense it, and then do they have the strength to correct it? So, for these next few slides, we're going to be talking about the frontal plane. And again, I'm actually going to have you pop forward a little bit just so you're front and center here. So movements in the frontal plane are, again, movements that operate from side to side, right? And this plane bisects the body. And then can I have you turn 45 degrees to your other side, actually? Okay. Yeah, that's perfect. So if I were to, in an imaginary world, if I were to put an MRI slice through Amanda, if I were to bisect her body into a front and a back section, all of the movements that happen in the frontal plane operate in the same directions as those slices, right? So some critical exercises that we can talk about, again, maybe take front and center here. Good. So in order to sense whether or not we're at a fault for our sense of movements in the frontal plane, again, those movements from side to side, something that you can do, and please be sure to do this in a way that's safe, you could you could start with having something in front of you, whether it be a counter or a chair. Amanda's just going to pull a chair up in front of her. And with two hands on that chair, you could put 1 foot forward and 1 foot back so that the heel of one foot is touching the toes of the other foot, right? Now, this is called a tandem stance. Now, if this is a little too challenging, you could also do what's called a modified or a semi-tandem stance, where you would put the ball of 1 foot on the instep of the other foot. So just to kind of help with the camera view here, if you can't safely put the heel of 1 foot to the toes of the other foot, you could stand so that they're just a little bit staggered. And Amanda's doing that for us here now. So in this tandem or semi-tandem stance, with either a friend or family member to support you, or a countertop, or a big heavy armchair, something safe to hold on to. If you try to stand in this position and just lightly touch that surface in front of you, and you feel that you're beginning to wobble from left to right, you may have some impairments in balance in that sense of movement, in that frontal plane, right? A more progressed version of this, and again, please be sure to do this in a safe way, either with friends or family, is if you were to stand instead of in that tandem position, if you were to stand on just 1 foot, just lightly pick up 1 foot, this is a more advanced version of that because you're making your base of support from left to right smaller and smaller, right? So let's see, Amanda, we're going to get rid of the chair now. I'm going to have you just turn your face towards the camera. And again, Amanda is a healthy young physical therapy professional. So please know, again, if you're doing this at home, please do this in a safe way. But talking again about that tandem stance, I'm going to have Amanda put 1 foot in front of the other foot for me, please. Perfect. And in this position, if you are assessing at home, whichever foot is in the back on the side that you notice that you are wobbling more with. So I'm going to say that again. If you notice that you're wobbling more with 1 foot versus the other foot behind, typically that leg, the leg in the back, would be your impaired side or your impaired leg. You might have more of a sense or strength deficit on that side. So for Amanda right now, she has her right leg back. When she has her right leg back, she looks very steady. But if I then have Amanda swap and she puts her left leg back, and all of a sudden I see that she's starting to wobble and I feel like I need to guard her, she may have some deficits on that left leg. So these are some things that we can do to kind of safely assess our balance at home. And if you notice that these things are challenged for this particular plane of movement, a couple of things you can work on just to improve your sense of that balance and your sense of that stability. You can go to a position where you find you experience a mild to moderate challenge. So if the 3 tiers of that are standing in that semi-tandem stance where the ball of 1 foot approaches the instep of the other foot, if that's the most base level, the next level up is a full tandem such that the heel touches the toe of the next foot. Or single leg stance would be the highest level of challenge. So using those 3 as tiers, find a level where you feel a mild to moderate challenge and try to hold that position in a way that's safe for 10 to 20 seconds per repetition, and then practice 5 to 10 repetitions based on your fatigue and how your body is feeling. So critical to listen to our bodies and what it's telling us. It will give us more data than we realize and appreciate. If we listen, pay attention, we'll notice, I feel unsteady or I feel tired, and it's important to listen when that happens. So that's what we're going to talk about as far as a sense of balance in the frontal plane. Now we're going to talk about our strength in the frontal plane. So there are a couple of key elements here as far as movements in the frontal plane and strength in the frontal plane. First being down at the ankles and the feet, and our ability to safely turn our foot into supination and pronation. We're going to demonstrate that in just a second. But then also at the hips and at the core or trunk as well. We're going to reorient ourselves here. We're going to pull in a table. And we just off the edge here. And let's orient this foot just a little bit more towards the camera. Perfect. All right, we've got white on white here. It's going to be tough to see. So Debbie, if I provide a background, can you get a pretty clear orientation of Amanda's foot here?
Yeah.
Okay, great. So I'm going to have Amanda turn this right foot. She's going to turn it out to her right side. And that's called pronation. And then I'm going to have her turn her right foot in towards her left side, and that's called supination. So why does this matter? If when we put our foot on the ground, if we feel that there's a sense of instability or rocking around this foot in the previous exercise, it may benefit you to strengthen this movement. A way that you can do that is I can have Amanda lie on her right side, please. And she can safely hang this right foot, her bottom foot, off the edge of the table. And then here in this position where gravity is trying to push down, if Amanda turns her bottom foot up against gravity, she's supinating her foot. She's going to work on the muscles that help this foot supinate and correct if she begins to go too far in the other direction when she's standing up. Conversely, if instead this side we find is having difficulty where it likes to curl in too much, Amanda, I'm going to have you turn all the way over, please. Perfect. I can have Amanda turn this foot up towards gravity the other way. Now, at home, why don't you go ahead and sit up over the side, please. At home, you can either do this in a position where you're lying off the edge of the bed, or if you want to come right to the end again, if you're sitting upright, and scoot back just a bit so we can get your feet in the shot here. Even just sitting upright, if we turn our feet inward and outward like Amanda is demonstrating here now, regularly practicing this movement, and even though it's not lifting a big heavy weight, just practicing, we're building that brain-body connection. We're helping our bodies become more aware of what it can do and what range of motion it has access to. So our body improves its sense and its ability to detect and correct when it needs to. Those are movements at the ankle. Next, we're going to talk about movements at the hip. Can I lie on your right side? We're going to demonstrate a clamshell.
It's very fascinating, Dave. Very fascinating.
Oh, that's great. Good. So there's movement at the ankle. Next, movement at the hip. Amanda's lying on her right side, and she's going to raise her left knee, keeping her ankles and her hips together. So this movement, if done correctly, should use some of Amanda's gluteal muscles up on the outside of her left hip. Come on back down and just do a few repetitions there for us. Perfect. So by using this muscle with repetition, again, improving our body's sense of where it is in space and improving its condition and its ability to fire when called upon, which again, in the instance of a critical fall, you want that muscle to be right there. You don't want it to be late. So those are some non-weight bearing movements at the ankle and at the hip. Amanda, I'm going to get you to come on down now, please.
Now, would that type of movement and exercise be okay for people who've had hip replacements?
To be certain and be safe, if you are near the time of a hip replacement, if you are within the first 3 months following your hip replacement, it is best to communicate with your doctor to be sure that your specific replacement is safe to do those movements.
Yeah.
Now, that being said, that movement, the ankles are certainly safe no matter what. The clamshell is usually safe. However, again, speak with your medical professional. And then ways to make it more safe are you could put a small pillow between your knees to prevent what's called adduction or a crossing of the legs, which is one of the big precautions for anyone who has recently had a hip replacement.
Mm-hmm. Yeah.
Very good question, Debbie, and thank you so much for bringing that up.
Oh, sure. It's just, one of those things that unfortunately happens when people, when older adults, when they fall, sometimes it's the hip that they land on. And, coming into the hospital in the emergency room, that's, we see either traumatic brain injury, shoulder injuries, wrist, hips, depending on the severity and also how they fall. So, we get a lot of patients with hip fractures, unfortunately. So it's very important to know what type of activities are appropriate once you're cleared eventually post-recovery by a doctor, and you're free to go about to do what you want to do in life, but still, knowing what is appropriate and what's good to continue doing to strengthen the muscle so it doesn't atrophy.
Absolutely. And to that note, it is so critical that if you have recently had a joint replacement or any other major orthopedic surgery, important to advocate for yourself. Make sure you know your post-operative precautions. They are so critical. And at the end of your day, even though you may have a fantastic medical team that wants to advocate for you and be there for you, it is so important to be your own advocate and make sure you know what you can and cannot do safely. Ask questions. We like questions. We like when people, help themselves and we're able to help people. That's why we're in our field. Absolutely.
Thank you.
Of course. So the next movement I'm going to have Amanda demonstrate, we're going to do what's called standing hip abduction. Thank you guys for your patience with all the scenery changes here.
No, this is great to have all this visual. Thank you.
Of course. So standing hip abduction. So again, movement in the frontal plane where these slices go through Amanda such that her front is front and her back is back. She's going to bring her right hip, her right leg out to the right side. She's going to flex her gluteal muscles, squeeze her hip bones, or I'm sorry, her hip muscles rather, and then gently bring her leg back in. She wants to make it a point not to tip left or right, and then she's going to repeat this typically for 10 to 15 repetitions unless you feel too much fatigue in that muscle. Another really good exercise, and we love this exercise, it's called a lateral walk or sidestepping. So I'm going to move a little bit out of the frame here so that Amanda has the whole frame to kind of demonstrate. I'm just going to move this guy again. If you want to face towards the camera and just do some sidestepping for us. So again, moving that frontal plane, moving from side to side. In this exercise, Amanda gets to work her ankles and her hip muscles. This is a very good exercise to do, really good to do in a narrow hallway at home where you can have your hands in contact along the wall or along a countertop. Very powerful exercise, very, very beneficial exercise.
What makes it powerful?
It's a safe thing to do 9.5 times out of 10, and it's very difficult to do it the wrong way. Some compensations that we see, if you want to demonstrate some lateral tipping for us. So if people have weak hips, you may see kind of this tea kettle effect where people are tilting left and right. But even this is not unsafe, it's just a little less beneficial. So this is something that you'll see physical therapists use for ankle injuries, for knee injuries, for hip injuries, for back injuries. The muscles involved with this particular movement are really critical to protect our bodies in a number of different positions and for a number of different potential injuries or impairments.
Very interesting. Thank you.
Of course. So we could go on and on about movements in the frontal plane, but I do want to also talk about the sagittal plane. So I'm going to go ahead and move ahead here a little bit. Okay, so the sagittal plane. The idea of the sagittal plane is that instead of bisecting the body sideways this way, now Amanda's going to be split down the middle, exactly, into her left and her right sides. So this direction, you know, when we hear about regular falls in the sagittal plane, one of the most common ones that we hear about are when people are reaching up overhead to try to reach into a high cupboard or cabinet. They may or may not feel dizzy and have a posterior loss of balance where they fall backwards. But with or without the dizziness, it just is difficult if you imagine the limbo to try to go over backwards, right? And to be able to recover from a compromised position there, right? So hopefully you're not limboing at home, but a number of other exercises do kind of use, not necessarily exercises, but activities of daily living or day-to-day activities do utilize movement in this sagittal plane. So, you know, again, looking up to a cupboard or cabinet could be one, but then also bending down to tie your shoe could be another one, and you would have a forward loss of balance with that movement. So when we're talking about movements in the sagittal plane, similar to how we talked about movements in the frontal plane, first we want to assess your sense of balance and your ability to kind of detect which way the wobble is happening. So for the sagittal plane, my favorite exercise to talk about as a base exercise is it's called a narrow base of support. It's basically, you just put your 2 feet close together, and Amanda's doing that for us now. And if you have an impaired sense or an impaired ability to have safe balance in the sagittal plane, you might notice that Amanda would start to wobble forward and back, forward and back. From here, it kind of jumps a little bit, and it's a little tougher to progress this as opposed to the previous direction that we were talking about, the frontal plane movements. From a narrow base of support, we typically go right into a single leg stance. But again, looking for, and single leg stance, and again, Amanda will be standing on 1 foot here. So if you're doing this at home, please do so with a friend or family member nearby, or with a safe countertop or heavy armchair to grab onto. but going to that single stance of balance, we now only have half of our body's resources. We don't have access to that other leg to be able to safely assess, that rocking and be able to correct that rocking. Some interventions, some things that you can do to kind of work against this if you notice that you're struggling in this area. We're going to bring this chair back in if you don't mind, please. Perfect. So I'm going to stand it back here, far away from the camera, facing this one, please. Yeah, perfect. Okay. So for this one, why don't you go ahead and hold on. And I'm going to have Amanda just do a simple heel raise or calf raise, depending on the verbiage that you prefer. But basically, Amanda is coming up onto her toes and then very slowly lowering back down. Now, another critical component that I haven't talked to at this point, and this is true across all pieces of balance, all pieces of strengthening, your ability to safely lower yourself from an elevated position or to safely bring a body part back after you've used it. So when we're talking about the hip kicks up to the side, your ability to lower that leg slowly, or in this instance, your ability to slowly lower your heels, it's an indication of what's called eccentric control. The reason that that word matters, that eccentric control matters, is it's basically your ability to voluntarily move with gravity, to not let gravity just knock you around however it wants to knock you around. Very important to have good eccentric strength. So the heel raise is one key movement in that direction. Another is the toe raise, so coming back onto the heels, right? If you find that you're regularly losing your balance backwards, holding on to something and practicing this movement where you're raising your toes and slowly lowering them down could be a really beneficial exercise. Conversely, if you find that you're regularly losing your balance forwards, doing the heel raise, pushing up and then slowly lowering down may be very beneficial to kind of help combat against that deficit. Other exercises moving up the chain. At the level of the knee, we can do a hamstring curl. So I'm going to have Amanda stand in place. And Amanda, fitness trainer that she is, she's demonstrating perfect form. A very common compensation are people like to bring the bent knee forward. And that's a little bit of a cheat. That's letting yourself off the hook. So really important to try to have the knees in line and bring this knee up to a nice perpendicular level with the ground. Coming further up the chain to the hip, I'm going to have Amanda kick her right leg back behind her. And you can call this, a back kick or a glute extension, a hip extension, depending on which lingo you want to use, but they're all talking about the same thing. That's the other thing when talking about these things. If you're talking amongst your friends or if you're talking to a doctor, there are a lot of different words to describe the same movement. So a picture is worth 1,000 words. So that hip extension, it works to build strength up at the gluteal muscles, and it helps to protect against back injuries. It helps to protect against hip injuries. Again, very good exercise to do. Speaking about what you had asked earlier about hip replacements, this hip extension is something that there will be precautions against if you've had an anterior approach for your hip replacement. They're not going to want you to bring your leg back behind you for some period of time. So, just kind of moving forward here, the transverse plane we're not going to talk about. It tends to be a little less relevant for fall prevention, at least at a fundamental level. But next steps. Okay, you learned a little bit about fall risk reduction. What can you do about it? First things first, get moving. Either contact, a local physical therapist, talk to your primary care doctor if you have a good relationship with them, talk to your local fitness trainer or community fitness group. Find someone who's going to help you figure out what your challenges are and how you can safely overcome them.
Great.
Get moving. Even just starting to walk day to day, doing some of the things that we demonstrated here today in today's presentation. It all starts with those first steps. Just try to build that habit, build a sense of accountability, and find a friend like Amanda had recommended earlier, just to try to get into the habit of trying to do some movement. And then Debbie, you just mentioned that you might have us back on another day. We'd be more than happy to do that. In the interim, ask us, ask your local PT. As physical therapists, we love to get involved with our community. It's a lot of fun for us. So please don't hesitate to reach out either to us or a local physical therapist, and say, hey, here's my story. I feel like I've got this problem and I just can't work my way through it. And we'd be more than happy to kind of take you by the hand and bring you from step to step.
Yeah, definitely. I am a big proponent in encouraging people if they start sensing that their balance is off, or they seem to be tripping, or they seem to be not as strong as they used to be. And if they feel overall, they feel okay, but it's more the muscles and their whole body trying to move it in the way that's really safe and efficient for them. I always like to tell people, ask your doctor for a physical therapy consult, see what they could do, see what exercises they can do for you. So that way you know exactly how to strengthen those particular muscle groups to help you be able to become more self-reliant and also feel confident when you move. Because when we lose that sense of confidence, when we start moving, that's when we start feeling like, okay, I don't want to go anywhere. I don't want to move. I'm just going to stay put. I'm going to ask my spouse to get me my water. I'm going to have somebody get me my groceries. And then it becomes a downward spiral of deconditioning, atrophy, lack of confidence. Then the fear of falling starts happening. So it just becomes a negative downward spiral of things that can be otherwise prevented by just asking and advocating for yourself. Like you said, Dave, advocating and asking for resources and ways to be able to help you become stronger.
Absolutely. Absolutely.
Yeah, definitely. So I have some more questions to ask you. You mentioned about, I love how you did the presentation where you broke down the three considerations that can put people at risk for falls. The atrophy, which can happen, sometimes people call it sarcopenia.
Okay, yes.
Yeah, another 25-cent word there, Dan. Sorry. But it's at what age? Is it 30 or 40 that our body just starts having this type of, not deconditioning, but the atrophy happens, right, of our muscles? And is it because of lack of movement, or is it just basic signs of aging?
I'll start. Yeah, so our body around 30 starts to lose our bone muscle mass.
Oh, can I just ask both of you? Sorry, Amanda, can you move closer to the computer just so we can see you and hear you both better?
Sure thing.
Yeah.
Let's see here. Hold on.
Awesome.
Bear with us a second here.
Awesome.
This guy again. I'm sorry, Debbie.
That's all right. So I was asking about sarcopenia and atrophy, and how, at what age does that typically start, and why does that happen?
Yeah, so there's a couple of different reasons. So around 30, our bodies can start to lose our bone mass, so how hard our bones are. So that can be really important because if we fall, we want to make sure our bones are strong so that they don't break. So around 30 is when you start to want to really start to focus on these exercises where you can start to really make sure that your bone does not degenerate. So anything that adds a load will help keep those bones strong. Other than that, so your muscle mass can start degenerating around that time as well. There's a term we like called progressive overload. So if you're not using it, you're losing it. And this can happen really at any age. So we want to start building healthy habits when we get this news and when we start to realize that, hey, I don't feel as strong anymore. So we want to start to do some of these exercises we were seeing today in a way that is a mild to moderate challenge so that you can build that muscle.
Definitely. Thank you. Now, as far as I do a lot of outreach and work in the community, this being one of them. And I also do a lot of falls prevention type programs for different groups. And the recommendation by the CDC to move an extra 150 minutes per week. That's a tough one for me to, I promote it because it's there, but, sometimes I'm in a group of people who are, walking in with a walker, a cane, or maybe an electric motorized wheelchair. I state what's recommended, but I also share with them, just move more. than what you have been. What's realistic for you? So that way I can empower them and not set them up for failure already based on the current recommendation. Of course, we want to be able to strive for something more, but can you speak more to that? How would you recommend people who do want to stay active, but now, we're still in the pandemic type phase and it's getting colder. People who typically would walk outside now, today is a very stormy day. What would you recommend that they do at home so that they feel like they are kind of working towards the recommendation and feel good about themselves?
So, there are definitely things that you can do at home. And I want to briefly step off and then circle right back around to it. I will also say that there are local resources. Again, we talk about 110 Fitness just because they're just down the street from us. And they not only talk the talk, but they really walk the walk as far as following CDC guidelines and regularly communicating with doctors to find evidence-based programs for community fitness for the aging adult. I would highly encourage you, wherever you are, whoever you are, look for these programs because they are real. 110 has their classes broken into 10 a.m.s versus 11:30s based on your level of function. There are people doing chair yoga. There are people coming in motorized scooters and on walkers, and they're exercising 5 to 6 days a week for, usually about an hour at a time, 45 minutes to an hour at a time. And again, the programs are safe and evidence-based. 110 is convenient if you're down near us, but if you're not, seriously, look for a program because they do exist. That being said, if you want to be safe at home, like you said before, anything is better than nothing. Communicate with us, communicate with a local PT to find a safe program that you can find scaled to your level of activity and your level of function. If you are chair bound, use your arms. If you can, safely stand for a short duration of time, so you can only stand for 10 minutes at a time. Stand for 6 to 8 minutes. Don't overdo, but do those 6 to 8 minutes and try to do them several times a day. It doesn't have to be 30 minutes all at once.
Mm-hmm. Definitely. Thank you. Now, as far as I really appreciated you covering the planes of movement. And was there anything else that you might want to add for people who, when you did the movement, the side-to-side movement, was that the sagittal movement or was that the frontal movement?
That was that was movement in the frontal plane.
Okay. So what other exercises can people do that can help address the total frontal plane so that way they feel like, again, at home, now that it's getting colder, what other exercises that people can do? And also, tangent, we're trying to prevent falls. But what happens when people are about to fall? Can you make a recommendation on the best way to fall? And maybe also a recommendation on the best way to get up from a fall?
So I guess starting with the exercises that work in that frontal plane, so side to side motion. So any exercise that targets your hips, like Dave was saying, the muscles on the outsides of your ankles or the muscles on the sides of your abs. So any exercises where you're challenging any of those three muscles, you can do at home. So the side stepping is one because it incorporates all three, and especially if you have a countertop or a tabletop at home that you can hold on to, that one can be very safe and effective if it's approved by your doctor. There are the ones on the table too, where if you're in your bed at home and you want to get some exercises and you can lay on your side, do those clamshells, or you can lift your leg up to the side as well to work those muscles on your side. Sitting can be a bit tougher with this one, but we were talking about the ankles you can do side to side. And then again, standing, holding on to something, anything where you're kicking out to the side or you're using those muscles that work you side to side.
Very good. Thank you. Thank you.
And then Debbie, you had asked a question about if you're going to fall, best ways to fall.
Yes.
So, if you're going to fall, it can be tough. whatever direction you're going in, I'd say the most critical piece is to try not to let your head hit the floor. I would make that everyone's priority. Whether you're falling to the side, whether you're falling forwards or backwards. If you're falling forwards, do try to brace your fall with your arms, and preferably both arms as opposed to only one. Consideration for a fall, you're counteracting the force of gravity, and the more points of contact that you have, or the larger area of contact, that force is going to be distributed more safely. So if you're going to fall either to your back or to your side, try to fall on your whole back side as opposed to one side or the other side. If you are nimble enough, try to roll with it a little bit. I know that's asking a lot. There isn't a perfect way to fall, but again, prioritize, protect your head, try to use your arms if you can, and try to fall on a larger surface area as opposed to a small surface area, such as only one hand or only one knee. Try to avoid doing things like that.
Yeah, I have heard not to stiffen your body when you're falling, to try to soften your body. And like you said, if you can, definitely protect your head, but roll with it. So that way you're distributing the pressure that we would exert onto the whatever surface area that we would be landing on, right?
Yes.
So what happens when somebody falls and luckily their head was not injured, but they were just a bit shooken up? What is the best way for them to get up from a fall?
You want this one, or you want me to take it?
I can start. Sure. Yeah. So first of all, make sure you're okay. Check for any bleeding, bruising. Make sure, you're feeling like you're in a good headspace before you start to do anything. So assess the area around you. Make sure you're in a safe area. And if you can, if there's something close by, you can hold on to that to brace yourself to start to stand up. If you're not, again, large base of support. So making sure that your feet are out wide, your knees are out wide, whatever you can to make sure that you have that base of support. The wider your body is, the more balance you have. So if you're able to get onto your hands and knees, you have a lot of points of contact. Your body's very spread out. You have a bit more balance and a bit more control there. And again, just one step at a time, go slow. And again, use anything close by if you can to help yourself up. Anything else to add?
Do you want us to demo?
Yes, that would be great. That would be great, because it's usually not covered in many types of programs, how to get up from a fall. I just feel that it's very important to be able to have some sort of a way to do it, so that way people will have an understanding.
Sure. Do you want to come around and guide me kind of with the cues you were just given a minute ago? So I've fallen and I'm on my side, and then it's kind of directed from here.
Yeah, so from here to you're on your side, I would suggest, first of all, make sure you're okay. From here, I would suggest, if you can, rolling onto your hands and knees. So rolling onto all fours from this position, pushing yourself up from your hands and your knees. And then if you're lucky to have a chair next to you, first of all, make sure that object is secure and it's not going to move around on you. You can place one hand on that chair. You can place even two hands on that chair if you feel safe. Push through. Use this to help yourself start to stand on up with one leg and then the other leg.
Very good. Thank you. Very helpful. Thank you.
No problem. Good question.
Very good. Now, what other questions would be good questions to empower people with when they are with their primary care doctor, so that they can properly ask for help with their balance, their gait, exercises? And what would make a doctor say, oh, perhaps you need a physical therapy consult, versus, oh, why don't you just go to the YMCA and join some exercises?
So I would say that the the factors of what pieces of your balance aren't working correctly are what's going to really dictate what you need. If your body is deconditioned, if it's critically deconditioned, you may need physical therapy or a one-on-one personal trainer with some history in the falls prevention or who specifically works with aging adults. That might be a good resource. As far as this is definitely physical therapy, people who have more of that neurological component, if they have any kind of cardiovascular history where their blood pressure is elevated and then drops, elevated then drops, if they have vertigo, some physical therapists specialize in treating vertigo. It's something we see here at our practice. There are a number of causes for vertigo or a number of reasons to feel dizzy like the room is spinning versus unsteady on your feet. And a specialist might be able to kind of help you look at the right pieces to make sure that you're looking at the right problems. Other things like I had mentioned in the presentation, make sure that your vision is healthy. You have a good prescription. Make sure foot health, super, super important. Good to have a good relationship with a podiatrist as you get older. If you have an impaired sense of pressure on your foot because of a history of diabetes or something called peripheral neuropathy. Again, sorry, Dan, if you have it, you know it. If you don't worry about it. All of these things, if there are more medical components to it, as opposed to, it's been a long time that I haven't exercised, right? If it's been a while, you may or may not need a physical therapist, but if there are these multi-system factors, you're probably going to need a PT.
Very good. Thank you so much. Very good point about foot care and being able to not forget about the feet, especially if you have the neuropathy, the numbness and tingling to your feet from diabetes or other types of disorders. So we are coming up to the top of the hour. That time flew by. So I wish you all a great day. And thank you so much once again, Body Mechanics, for being here today. And thank you, Quincy Public Library, for continuing to host this program. Bye.